All right, let's switch gears a little bit and talk about oils. So are all oils healthy? Well, we talked about this a little bit in part one, and that we have a balance basically that should exist between omega-6 and omega-3s, right? So our polyunsaturated fatty acids, our PUFAs, are divided into two classes, omega-3s and omega-6s. The two major omega-6 acids that are typically consumed in the diet are linoleic acid and arachidonic acid. Western diets are dominated by the omega-6s, but it contain only smaller amounts of the omega-3s, with the ratio of the omega-6 to 3 reaching as high as 20 to 30 to 1. Generally speaking, it should be in the 1 to 3 to 1 range. That's typically what has been shown to be the healthiest for individuals. So excessive amounts of omega-6s and a very high omega-6 to omega-3 ratio has been shown to promote the pathogenesis of a variety of chronic problems, including cardiovascular disease, cancer, inflammatory conditions, autoimmune diseases, where increased levels of omega-3s and a lower ratio exert suppressive effects or anti-inflammatory effects. And then there's mounting evidence from both human and animal studies that's demonstrated that omega-3s, primarily EPA and DHA from fish oil, can suppress inflammation and have beneficial roles in a variety of human diseases. Where are we getting all of our omega-6s from? That's the question. Well, we're getting it a lot from our vegetable oils. We're using a lot of vegetable oils because they're cheaper in nature than our fish oils and other types of omega-3s. And so we're getting a lot of these through vegetable oils and cooking vegetable oils. So our safflower oil, sunflower oil, corn oil, soybean oil. If you go to the eastern shore of the East Coast where I'm from, you have fields and fields and fields of corn and soy. That's pretty much all that you see nowadays on farms. It's quite sad. And a lot of it's being used as feed for animals. And it's also being used as of course, to make these oils as well, which of course then make food. So a lot of these oils, unfortunately, are very, very high in omega-6 fatty acids. Sunflower seeds, walnuts, even though they're amazing for you and they look like a brain and they're good for your brain, they do have a higher amount of omega-6s. Pumpkin seeds and then corn and soy-fed animals, typically in their fat, they have a higher amount of omega-6. And that's where a lot of these studies are looking at inflammation and cardiovascular problems and inflammatory diseases. That's where a lot of it's coming from. Okay, so then we also have our omega-3 fatty acids, which are found primarily in salmon, herring, mackerel, our oily fish, sardines, and a lot of our fish oil supplements and flaxseed oil have a lot of omega-3s. Flax seeds, walnuts, again, have omega-3s, chia seeds, and then, of course, grass-fed and grass-finished animals. So these animals have been fed grass their entire life. Grass naturally has omega-3 fatty acids in it. So the animals typically by nature have a higher level of omega-3 in their fat in their flesh. So you need to have your patients look for grass-fed, grass-finished, or 100% grass-fed. If it doesn't say 100% grass-fed, it's not, you can't assume that it's been fed grass that much of its life. It can be fed grass 3% of its life and then fed corn the rest of its life, and it can still say grass-fed. So you have to be very, very careful about labeling. And then our omega-9 fatty acids, our olive oil is the highest source, and another great source of oil here. I wanted to mention nuts because everybody is all nutty about nuts these days as a snack and as a replacement for meals and yada, yada, yada. But some nuts, I would say, don't have the beneficial ratio that we might want to be looking for. For example, walnuts have a 4 to 4.2 omega-6 to omega-3 ratio. That's not bad. 1 to 4 is kind of where you want to be. Macadamia nuts, 6.63, not too bad. Cashews, 47 omega-6 to omega-3 ratio. Almonds, 278, and peanuts, 1720. So again, just because it's nuts and they have good protein and some good fats in them doesn't mean it's always the best fats, especially in light of inflammatory conditions, especially in light of autoimmune problems. You probably want to have your patients shift more towards omega-3s and try to be able to lower the ratio as much as possible. So let's talk specifically about rheumatoid arthritis. And in one of the earliest studies looking at fatty acids, this was all the way back in 1985, so it's an oldie but goodie. This looked at fish oil supplementation and rheumatoid arthritis. 17 RA patients consumed a daily supplement of 1.8 grams of EPA for 12 weeks. Really not even that high of a dose, but 1.8 grams is not too bad for a starting dose. At the end of the treatment, the EPA intervention significantly shortened morning stiffness time, compared to the control group, and at 12 weeks, and it lessened the number of tender joints at 12 weeks from baseline. So again, right around that 3-month mark, we're going to start to definitely have some benefit here. So the morning stiffness and also the tender joints were also improved after just consuming 1.8 grams of EPA per day. And there's been quite a few studies looking at EPA and have shown similar results. This is another study here that demonstrated that the number of tender joints significantly improved from baseline after both a low dose, this is 35 milligrams per kilograms combined EPA DHA, and high dose, that's 80 milligrams per kilograms combined intervention with fish oil supplement. In addition to the clinically beneficial effects, this leukotriene B4, a metabolite of omega-6, generated by neutrophils of the fish oil treated patients, decreased significantly. So again, we have these inflammatory markers that are being reduced, and we also have tender joints and subjective improvements just by consuming a little bit of fish oil. So I think that's a really great study. And fish oils, I would say, should be a primary focus when it comes to RA and using some of these oils therapeutically. And other oils have actually shown some benefit as well. Specifically, borage seed oil in RA has been shown to be helpful. Borage seed oil does contain a high amount of gamma-linolenic acid, which actually is an omega-6 fatty acid, and it's shown an impressive effect. So 1.4 grams per day for 24 weeks reduced joint pain in 37 patients with RA, and 2.8 grams per day for 6 months showed similar results in 56 patients with RA. So borage seed oil could be another individual standalone treatment, or you can combine it with fish oil to try to get the maximum benefit, especially trying to work those omega-6 to omega-3 ratios a little bit better too. And then olive oil has been studied, actually. So the polyphenols in extra virgin olive oil have anti-inflammatory benefits. And olacanthal specifically is a compound extracted from EVOO, has been shown to inhibit the same cyclooxygenase pathways and prostaglandin pathways as does ibuprofen. And in one study, the combination of extra virgin olive oil at 9.6 milliliters per day plus fish oil was more effective than fish oil alone in the treatment of RA. So where do you start when you have a patient with RA? There's been some research that says start with borage seed oil as a standalone. There's been some that says start with olive oil and fish oil. Really, you're not going to be able to go wrong. I think you're going to be able to get a good combination of multiple different oil types, your omega-3s, your 6s, and your 9s, and usually patients are going to benefit. I would just probably recommend taking things at a therapeutic dosage level to make sure that you actually have an effect. Over here on the right, we have the anti-inflammation and suppressive effect of autoimmune diseases. Here we have our omega-3 polyunsaturated fatty acids, where we're inhibiting NF-kappa B. Here we have our omega-3 polyunsaturated fatty acids over here that you could see as inhibiting Th1. And we're going more towards Th2. So, hopefully we're having a better seesaw effect and reducing this Th1 dominance, which has been shown to have an effect in some of our tissue-specific autoimmune diseases, including RA. Right, so RA is more of a Th1 dominant condition. And so by using some of these omega-3s, we can actually exert a positive effect. So we haven't talked at all about lupus, either in part one. We talked about it a little bit today, but the lupus is a common autoimmune disorder with diverse clinical manifestations. It does impact people usually systemically. It does include inflammation, blood vessel abnormalities, immune complex deposition found throughout the body, and they're associated with autoantibodies against cellular components. There's been 7 major published clinical studies focusing on the relationship between omega-3s and SLE. All but one of the clinical studies reported beneficial effects, including the improvement in endothelial function, disease activity, or inflammatory markers following the implementation of omega-3 fatty acids in these patients. In all of the studies with positive outcomes, more than 12 weeks of intervention appeared to be necessary. So again, right around that 3-month mark needs to be got to build things up over time to have some kind of therapeutic effect. In a recent randomized placebo-controlled 6-month trial involving 50 SLE patients, the patients who received the omega-3 intervention, that's 4.5 grams combined of fish oil, showed remarkable improvement in their scores derived from this thing called the Physician Global Assessment and the RAND 36-item short form health survey, basically just looking at subjective evaluation of their disease progress. And they also showed that circulating levels of inflammatory markers, including IL-13 and IL-12, were significantly decreased as well. So in lupus, I definitely be recommending fish oils as one of my treatments.